Welcome to the We Level Up Treatment Center video series. In today's video we will discuss angeldustdrug. What is PCP drug? PCP effects, angeldustdrugs hazards, and treatment options. Angeldust is the street name for the drug phencyclidine or PCP drug, a powerful sedative and hallucinogen. Its effects include disorientation, hallucinations, loss of coordination, agitation, and increased body temperature and heart rate. If you or someone you know is experiencing any of the effects of angeldust, please seek medical help immediately. The hallucinogen phencyclidine or PCP drug can be smoked as fry or marijuana cigarettes mixed with the narcotic angeldust. It is a white crystal powder. The adverse effects of angeldust medications can range greatly from sensory alterations to schizophrenic-like behavior to stroke, anxiety, and depression, and the consequences of angeldust are unexpected. What is angeldust or what is PCP drug prohibitions? Angeldust is prohibited, according to the U.S. Food and Drug Administration, FDA. The Controlled Substances Act classifies angeldust as a substance in Schedule II. Meth and cocaine are among the substances under Schedule II that are most susceptible to abuse. Because of this, using these medicines excessively might cause significant physical or mental dependence. Angeldust medications are used by people of various ages. An estimated 6 million Americans aged 12 and older have used PCP or angeldust at least once in their lives, according to the U.S. Drug Enforcement Agency, DEA. The survey also showed that many teenagers and young adults use this substance. Over 225,000 people in these age groups used it at least once, as did 777,000 people in the 18-25 age range. What are the street names of angeldust drug? There are numerous street names for the substance known as angeldust or PCP, including hog, amoeba, STP, supergrass, zoom, belladonna, peace pills, boat, ozone, animal trank, sherm sticks, embalming fluid, angeldust, the drug that turns you into a zombie. Drugs that cause mental alterations include angeldust. This indicates that angeldust medications alter behavior, mood, and how users interact with others in their environment through acting on the brain, central nervous system. Angeldust medications are thought by experts at the National Institutes of Health, NIH, to interfere with some brain chemicals' regular functions. Drugs named angeldust fall within the category of hallucinogens. These are drugs that can make you hallucinate. These are perceptions that you have when you are awake that seem genuine but are actually the product of your imagination. A dissociative substance is frequently referred to as angeldust or PCP. The drug user experiences a sense of disconnection from their body and environment. You may have the following side effects after using this medication. You are floating and disconnected from reality. Euphoria, or rush, and less inhibition, similar to being drunk on alcohol. Your sense of thinking is very clear, and you have superhuman strength and aren't afraid of anything. How is PCP used? Searching for what is PCP drug and PCP use, then continue watching. Street names for the recreational drug phencyclidine, PCP, include angeldust, hog, and love boat. It is a tranquilizer that also has stimulant, depressive, and hallucinogenic properties. It is risky and might result in long-term bodily and mental problems. Angeldust medications, also known as PCP, come in a variety of capsules, tablets, and colorful powders that can be ingested, smoked, or snorted, intranasal route. The most popular way to take angeldust drugs is through recreational smoking. The PCP foundation of this angeldust medication is in liquid form. Ether is a highly flammable solvent that is frequently used to dissolve the narcotic PCP or angeldust. Angeldust medicines are typically sprayed over leafy plants like parsley, mint, oregano, or marijuana to be smoked. You could also inject PCP. Depending on how you utilize angeldust medications, you may experience their effects quickly, shooting up through a vein. Angeldust drugs effects start within 2 to 5 minutes. Smoking PCP. When smoking PCP, The effects of using this drug begin within 2 to 5 minutes, peaking at 15 to 30 minutes. PCP ingestion, eating PCP, swallowing. PCP ingestion is another method of how PCP is used. You may ask, how is PCP ingested? PCP is typically mixed with food or drinks or in pill form. Angeldust's effects usually begin within 30 minutes. The effects tend to peak in about 2 to 5 hours. Harmful effects of PCP, most common PCP drug signs and symptoms. Low to moderate use or doses can cause numbness throughout the body and loss of coordination. Large doses can cause someone to be very suspicious and not trust others. The person might even hear voices that are not there. As a result, the person may act strangely or become aggressive and violent. Angeldust drugs can increase blood pressure, heart rate, body temperature, and breathing rate. At high doses, angeldust can have an opposite and dangerous effect on these functions. Because of angeldust drugs' analgesic or pain-killing properties, if someone gets seriously injured, that person might not feel pain. Using the drug angeldust for a long time can cause memory loss, thinking problems, and problems talking clearly, such as stuttering or slurring words. Mood problems, such as anxiety or depression, can develop. This may lead to suicide attempts. A very large dose, usually from taking the drug angeldust orally or by mouth, may cause heart arrhythmias, kidney failure, muscle rigidity, seizures, or even death. Side effects of angeldust or side effects of PCP. Impaired coordination and judgment, disorientation, anxiety, delusions, hallucinations, slurred speech, violent behavior, elevated heart rate and blood pressure, chest discomfort, and coma are just a few of the possible PCP adverse effects. Memory issues, ongoing speech difficulty, sadness, paranoia, and weight loss are examples of long-term negative effects. How does PCP make you feel? Angeldust can cause dreamy and floaty or numb experiences because it is an anesthetic and pain reliever. Your mood and feelings can shift in unexpected ways thanks to angeldust. A number of adverse effects of PCP include: it can change how you see reality. You can have hallucinations and see and hear things that aren't there. How you experience time may change. Time may speed up or slow down. It might make you feel really happy and upbeat. It might make you feel very down, panicky, and paranoid. You may believe things that aren't true. Some people become more aggressive and violent. How does angeldust make people behave? Angeldust use can result in a severe psychotic episode. You cannot reason, distinguish between reality and your imagination, or behave normally if you have this mental illness. These conditions are transient. Dangerous effects of angeldust drug overdose. After the initial use, its effects may begin within 5 minutes. After that, it can take a little longer, but its effect will become apparent in just a few hours. The effects are known to continue for several hours despite possibly beginning quickly. Furthermore, if the dosage is strong enough, the effects may linger for as long as 2 days. As a result, a drug overdose using this substance may be fatal. Because this drug's side effects might range from mood swings to suicidal conduct or paranoia to outright lunacy, high doses produce significant dissociation. The person no longer acts like themselves and also has no notion of who they are. PCP drug signs and symptoms of angeldust overdose. Severe agitation, slowed or irregular heartbeat, dilated pupils, increased body temperature, convulsions, vomiting, and coma are all indications of a PCP overdose. An overdose may be lethal in some circumstances. The most typical PCP drug overdose warning signs and symptoms relate to agitation, overly excited, violent behavior, altered state of consciousness, side eye movements, psychosis, loss of contact with reality, uncontrolled movement, lack of coordination, catatonic trance, the person does not talk, move, or react, convulsions, hallucinations, high blood pressure, coma. Get the facts about angeldust death. PCP can have potentially fatal adverse effects when used in large dosages. A PCP overdose can result in severe depression, memory loss, difficulty speaking, kidney failure, a high body temperature, and twitching muscles. Even though they are experiencing overdose symptoms, PCP users may be hooked to the substance. They might not be utilizing the drug to get high anymore. Addiction symptoms include using PCP to deal with cravings and prevent withdrawal. PCP starts to show symptoms at 0.05 mg per kilogram, and a dose of 20 mg or more can result in coma, death, and seizures. It is primarily metabolized by the liver, and 10% is eliminated in the urine. Both the intravenous and inhalation routes, which are the most common methods of administration, cause symptoms within 2 to 5 minutes. Symptoms from oral ingestion appear within 30 to 60 minutes. Although the half-life is thought to be 21 hours, depending on the dose, symptoms might persist anywhere from a few hours to up to 48 hours. Because PCP is fat, soluble and can be released from lipid reserves and adipose tissue, recurrent, variable symptoms may develop days to months after the initial use. Angeldustdrugs/PCP drug addiction treatment. If you or someone you know is struggling with addiction to angeldust or PCP, there are several treatment options available. The most common type of treatment for angeldust addiction is cognitive behavioral therapy or CBT, which helps individuals to identify and modify the behaviors that lead to substance abuse. Medications may also be used to manage withdrawal symptoms and help with cravings. It is also important to seek support from family and friends, as well as treatment from a qualified addiction center like the We Level Up Treatment Center network. That's it for today. If you like our video, please let us know. Have a great day.